Dr. Shakin, I'm wondering how common is teeth loss during pregnancy and what causes it?
Well, sure, Randy. So when you go through pregnancy, a lot of things change in a woman's body. Of course, you have a lot of hormones. You use up a lot of nutrients in your body to feed the child. Sometimes you lose calcium in your bone and in your teeth, and you can get more recurrent decay. You also have pregnancy gingivitis oftentimes, where the gums get a little swollen and uncomfortable. They bleed more easily. And so because of all of that, sometimes you do have dental problems. They used to say, the old adage was, you lose one tooth with every pregnancy. Well, if you have enough pregnancies, you're going to lose a lot of teeth, and sometimes you lose more than one. I'm not saying that happens all the time. Certainly it doesn't, and that's good. But in some situations it does, if your teeth are more prone to decay, if you have gum disease to begin with, or gum problems.
Alicia, I watched some of your YouTube videos and you were really open about how you may have been malnourished or just sort of hesitant to go to the dentist due to prior bad experiences. And I want to start with you talking about why you think sort of that lack of nutrition led to your body sort of stripping the nutrients that then led to the teeth loss.
Well, when I was little, the first thing I remember learning about family genetics wise with teeth, I knew that my great grandma had needed dentures when she was 20 after her first pregnancy. But my mom and grandma didn't have dental problems. When I was a baby, I had a dental injury when I tripped and fell on a wooden toy that split the root of my teeth all the way up through my gums. So when those teeth grew in, I got two separate teeth as baby teeth. And when the full grown adult tooth came in, it was like a half size baby size tooth. I don't know what happened to the rest of it, but it looked like a baby tooth. So I always had an uneven, crooked smile. And when I was little, I was allergic to almost everything. Like I had to have goat's milk. I couldn't have most dairy, cheese, eggs. I was on a very limited diet and I was allergic to almost every kind of medicine. I got sick a lot with hives. I had to get allergy testing all the time. I was almost labeled failure to thrive. And then they started taking me to McDonald's. So I started gaining weight. I did put the weight on, but thanks to McDonald's, which isn't the most healthy place to be. And throughout my life, I think from my experiences in childhood being very limited on what I ate, I think that impacted my health throughout my whole life. I'm still a very picky eater. I try to eat really well and I take vitamins and everything, but I'm aware that I'm a like sort of picky eater. So that's not been the best for me. And definitely in my teenage years, I didn't always eat right. I think that definitely played a role, so that by the time I did get pregnant when I was somewhat young still, I was 21, I just wasn't really set up I looked healthy. That's the thing. People can look so healthy and look amazing, but you can't always know what's going on inside their body and how it's going to react once you're pregnant, and on top of all those other things.
And I heard a lot in what you said as far as years of eating McDonald's and sort of being a picky eater contributing to needing those nutrients and your body stripping it from your teeth to provide. Right. Dr. Shakin, I wonder what vitamins or foods you recommend for expecting mothers or women who are considering becoming pregnant to eat so they can sort of vamp up and prepare their bodies and their teeth for pregnancy, and any other ways you may have to prevent the teeth loss.
Obviously, Alicia's history played a big role in her problems and her poor nutrition as a child, even growing up to as an adult, eating unhealthy diet, and I think that was and the fact that she was sick, she probably had a little bit of vomiting over the years, and that can weaken the teeth as well, the acid in the body. So, and once that happens, it's hard to fix it, right? But if everyone, not just pregnant people, but everyone should eat a healthy diet that includes, a mixture of fruits and vegetables, some proteins, some limited carbohydrates in the day, but healthy foods, right? And if you do that, and you don't really necessarily need a lot of vitamins, but when you're pregnant, you do need some extra vitamins, and we do recommend neonatal vitamins, to be taken. And that's something you discuss with your OBGYN. It's always important to eat healthy, and also, like we talked about earlier, to take care of your mouth and clean them well and brush and floss and rinse and on a daily basis. So it sounds like Alicia's problem started at a very young age and continued into her adulthood. And that's why the pregnancy probably just was the last straw that kind of pushed her teeth over the edge.